Good afternoon. I'm Jasmin Randolph-Taylor. I'm a junior legal communications major, sports administration minor from Trenton, New Jersey. And the purpose of my speech is to discuss the social injustices of healthcare disparities in breast cancer as they pertain to minorities. Love your boobies. It's a funny little statement, but it is one that is very important to women all over the world and even some men, especially if they're of African American descent or another minority group. Breast cancer has been a big epidemic for women and men over the last 3 decades, but even with the recent declines in death and diagnosis, BreastCancerAction.org's numbers show that the African American community, as well as other minorities, are still among the most highly affected by the disease. There could be many reasons for breast cancer action statistics, but disparities in breast cancer screening, healthcare options and help for low-income families, and death rates among minorities are the 3 that I will focus on today. Healthcare disparities, whether old, young, low, or high income, have always been an issue for the African American communities as well as other minority communities. Breast cancer is just one of the many diseases and healthcare issues that continue to plague our communities with these disparities. I am credible to speak on this topic because my aunt is a breast cancer survivor and I have been an advocate for breast cancer awareness since her diagnosis. Like my aunt and many other women who are dealing with or have dealt with breast cancer, the first step is getting checked out. Mammography is just the beginning of the process to detecting and preventing breast cancer, but unfortunately there are many barriers that keep some, specifically minorities, from receiving this service. According to Susan G. Coleman's website, some women are less likely than others to receive mammography screenings. This site states many reasons such as low income, lack of access to mammography centers or lack of transportation to one, lack of usual health provider, and sometimes cultural and language differences. These reasons have led to many gaps between the races, such as death rates and diagnosis among minorities, increased risk in lesbian, gay, and bisexual women, and inaccessible equipment for people with diagnosis with disabilities, as the website also states. Like screenings, treatment and other help for breast cancer are also controlled by healthcare services. Having health insurance is an important factor in any and all things pertaining to your health, such as health access to doctors, treatment, and sometimes even consultation. For many minorities and low-income families, having access to this insurance and equal health care opportunities can be difficult. According to the Commonwealth Fund Insurance Affordability Report, nationally, more than half of the people with low income and 20% of those with middle incomes were either underinsured or uninsured in 2012. And a person who is underinsured lives in a household with insurance but still spends 10% or more of their income on medical care, excluding monthly premiums. This explains the hardships faced by many low-income families. Being underinsured can cause many issues in access to treatment because of affordability. Healthcare insurance coverage and treatment access are a few examples of other factors that lead to death rates in minorities besides their race. Susan G. Coleman's website states that African American women have a 41% higher rate of breast cancer mortality than white women, and breast cancer is still the most common cancer among Hispanic women. Though race may play a role in these statistics, BreastCancerAction.org states that these disparities in breast cancer stem from a complex interplay of economics, power, racism, and discrimination that leads to a variety of social injustices, which shows that there are other factors that contribute to the death rate gaps in African Americans and the unfortunate diagnosis numbers in Hispanic women. Breast Cancer Action also mentions disparities in breast cancer outcomes among different racial and ethnic communities are based on the inequities of where we live, work, learn, and play. This statement demonstrates how much the environment can affect these disparities. Another could be the chemicals we ingest on a daily basis. There are over 85,000 synthetic chemicals on the market today, from the preservatives in our lipstick to the pesticides in our fruits and vegetables, as written by BreastCancerAction.org. Mistrust in the healthcare system is another factor that can affect these disparities amongst minorities. Despite better treatments and increased access for many women, 40,000 women still die from the disease each year. A woman is diagnosed with breast cancer every 2 minutes. In the 1960s, a woman's lifetime risk for breast cancer was 1 in 20. Today it is 1 in 8, says BreastCancerAction.org. In conclusion, there could be many reasons for the different social injustices in breast cancer, but the statistics show that disparities in breast cancer screening, healthcare options and help for low-income families, and factors for death rates among minorities definitely contribute to the problem. Hopefully more attention and change will be brought to these issues because, as stated previously, those in the African American community, as well as other minorities, are still highly affected by the death rates and diagnosis of the disease despite the recent declines. I hope this information has helped inform all of you that being more attentive when it comes to matters of your health and making sure that you are covered and getting annual screenings for breast cancer can save your life. Thank you.